Hello, and you are very welcome back to the Public Eye Business Podcast, brought to you by Granite Exchange. I'm your host, Sarah Travers, and throughout the series I'm speaking with local entrepreneurs and business owners to learn more about how their companies have come to be, to gain insight into their growth and find out how they continue to innovate. So wherever you get your podcasts from, remember to keep an eye out for all new episodes and subscribe to stay up to date. Today I'm joined by Lisa Hughes, who is the director of Mourne Private Clinic. Lisa, you are so welcome to the podcast studio. How are you doing?
I'm good, Sarah. How are you?
I'm great, and I'm really excited to hear all about your wonderful business. A little bit of background. Lisa is, as I said, the founder and director of Mourne Private Clinic, which is a private clinic based in Newry. With a background in radiography, Lisa identified a need for affordable and accessible ultrasound services in the area. So in 2015, she established Mourne Scan Clinic, which has since become a trusted provider of non-invasive diagnostic imaging. Now, Lisa has just recently opened the doors to her brand new business, Mourne Private Clinic, Lisa has recently just opened the doors to her new business, Mourne Private Clinic, bringing a regional first to Newry with the DEXA scanning and X-ray service. So this new private health hub houses a number of medical diagnostic services, including private ultrasound, genetic screening, hereditary cancer gene testing, DEXA scanning and X-ray, alongside private blood tests, physiotherapy, pelvic health services and CBT counselling, also a dietitian service from carefully selected partners. So as you can see, Lisa, you're overall a dedicated healthcare professional and an entrepreneur who remains committed to improving access to essential medical services for everyone right here in your community. It's been quite a journey. How did it all begin?
Well, I could take you back to, I suppose, education, the first part, which I went to Our Lady's School here in Newry. And I loved it. I loved the school and really enjoyed that time of my life. And then I went to University of Ulster. At that time, the campus was in Jordanstown to do radiography, although it's moved on further up the coast now.
And why did you choose radiography?
I suppose it had to be medically based for me. I suppose my dad from a young age had all sorts of health issues, heart issues basically, and I did spend a lot of time in and out of appointments with him in hospital, visiting him in hospital, and I just had such admiration for the doctors and nurse and staff within the hospitals that I just had a real interest. You know, I would sit and read his chart when it was at the end of the bed, and those days you hung the chart at the end of the bed and you would sit and look through it. It was really interesting, looking at the ECGs and that type of thing. I ended up doing radiography and really enjoyed the course. My first job was in Our Lady of Lourdes Hospital in Drogheda in 1998. It was a great teaching hospital, really enjoyed it. I don't know if you remember the Millennium. I was on call the night of the Millennium when we were waiting on those hospital equipment.
World?
Yeah, we thought it would all blow up.
Oh, that's right, the Millennium Bug. Yes.
Millennium Bug. It never happened. Very underwhelming. Everything just went on as normal that night, just the normal Saturday night people in and out. But it was a really great learning experience working there. It was a very busy hospital. And then in 2000, I got the job of my dreams in Daisy Hill Hospital. I always wanted to work locally. I was recently married and it was perfect. I wanted to be close to home. So I liked it enough to stay there 16 years. And I really enjoyed that job, everything about it. Learned so much, had great colleagues, did lots of courses to further my knowledge within radiography, did CT course, did an ultrasound course. And because it's a small hospital, you sort of get to do lots of things. You know, you're not really kept to one wee narrow field. You can do lots. So I was doing X-rays 1 minute, dental X-rays another minute, CT scan one day, and then moved into ultrasound to basically do ultrasound scans. So I'd be doing ultrasound in the main X-ray department, and then I'd be working in maternity unit doing ultrasounds on pregnant ladies. So that's why it was such an interesting job, and I really enjoyed every day of that. I went part-time when my kids were young, and that was a great opportunity then for me to work part-time in the hospital, and then I saw a little niche, I suppose, where I could work in the afternoons for myself. And that's really how it all began.
Gosh. And what ages are your kids now?
They're 21, 19 and 16. So we've GCSE student in the house, which is, yeah.
Stressful. Now, when you obviously eased yourself into self-employment, but what did that look like at the start? And primarily it was ultrasound you were offering.
Yes, well, it was only ultrasound for pregnant ladies because at the time I was doing obstetric scans, and I really liked doing that. People would often say to you, do I only get 2 scans in my whole pregnancy?
That's right.
And that's enough for lots of people who are low risk, but some people are worriers. They suffer really severe anxiety in pregnancy, and to be able to help them out with just having a look, checking things over, showing them that the baby's growing, showing them that there's a little heartbeat, that's a real privilege for me to be able to do that for them. So I think my colleagues thought I was completely crazy when I went out and bought myself a scanner.
And how much did a scanner
rented
cost?
a room. At that point, it was a small scanner. It was actually a portable machine, really good machine, and a dedicated obstetrics machine. But I think it was 26,000 at the time.
Wow.
That's nothing for a piece of medical equipment, I can assure you. But it did the trick, and it was just for me to dip my toe in the water.
And had you looked to somebody else doing this, or did you, was anybody else doing anything like this in the area?
Certainly not in this area. I know there were in England. In this area, really, you had to be having private medical care with an obstetrician to get any scans outside of the NHS. And, the NHS certainly would scan you if there was a problem. But if you're a low-risk pregnancy, you saw the midwife. You didn't necessarily see a consultant. And the midwife services are amazing. But they don't always scan you because it's not always necessary.
I remember that too, and with my own pregnancies and waiting to the 20-week scan, and 20 long weeks until you could just see your little baby on the screen. And I can remember also feeling that sense of disappointment because it was so short and I couldn't really see much. And if you could just be able to check in every now and then just to reassure, especially I suppose if people have had bad experiences or
well, that's
legitimate
exactly
concerns.
Absolutely. And, now a pregnancy test will show you that you're pregnant at 3 weeks. So really it's a long time to 12 weeks.
It really is.
To tell you that your pregnancy is viable. Mm-hmm. And then it's a long time to 20 weeks when you maybe don't have any movement and you really want to check in. Mm-hmm. So
you got
between
started.
all of that, I got started.
And the need was there? People loved it, did they?
The need was there. So eventually I had to sort of make the choice. Do I want to stay with the NHS or do I want to, develop the small business that I had started out? I loved it so much. I loved private practice. It was a whole different ball game from working in the NHS. I was solely responsible for the scans that I was doing instead of being part of this huge umbrella of the NHS. So it was very daunting. I get lots of advice from colleagues, from radiologists who, some were supportive, some just said, you're mad. Some just said, make sure you have good insurance.
I was going to say, yes, make sure you've good legal advice and insurance.
That's right. So,
but you could see how you could talk yourself out of it or be talked out of it.
Oh, very easily. I mean, it's easy to go to work 9 to 5. It's completely different when you're working for yourself. I mean, you have to be a jack of all trades and you learn very quickly that how social media works, how finance works, something I never had to worry about before. Everything was done for me. The money arrived in my account at the end of the month. No questions. And now I had to figure that out for myself. But I enjoyed that. That was a real challenge. And my husband is in business, so that was a good support at home. He could guide me and help me out in that regard. So all in all, I think I enjoyed every bit of it,
And were you working on your own or did you take anybody else on?
For the first, I think it was 2 years, I worked on my own. And that was great. And really, that was fine at the time. I wasn't busy enough, really, to employ people. Wasn't making enough money to employ anybody. But after a couple of years, I realised, I'm going to need some help here. That was the tough bit. That was a bigger decision for me than leaving the NHS because you'd be employing somebody who had a mortgage or rent to pay. You had the responsibility for them. And for me, that was just an unbelievable responsibility to have somebody in your employment.
What difference did it make when you got over those fears?
I think I appreciated that it was actually quite a privilege to be able to give someone a job, and a job that you could mould and say, look, we can make a lovely working environment here. We can look after each other and make our days 9 to 5 really pleasant. And we can choose what we want to do. So I was quite happy to work, not to be the big boss, but to be the person who'd say, well, what would you think if we worked a bit later today? Or what do you think about, advertising this way? Or, whatever we might be doing, or just improving the services. It's great to have somebody to soundboard off that was in the same kind of work that I was in, because my husband's not in that type of work.
And how did you recruit?
Oh, I poached a member of staff.
Yeah, I was going to say, you thought, I want you.
That's exactly it. I knew a girl, Louise, who's now practice manager, who worked in the NHS. I knew she was a little trooper. She worked hard. She knew from the ground up. She was great, and now she's practice manager, and she's now an expert in social media and advertising and finance and all of those bits and pieces. And she's not the sort of person, and I know she'll not mind me saying this, who likes change. She's very nervous about change, so moving from Mourne Scan Clinic to Mourne Private Clinic was a huge thing for us all, but for the practice manager in particular. But she has been amazing, and I have to say she has absolutely come into her own the past number of weeks. So she's my wingman, and I couldn't be without her. So I really appreciate the team that we have around us. We're all part-time. Well, I'm full-time, but everyone else is part-time. So it's great because we all sort of cover each other's backs, and it's a great way, I think, to run the business.
And do you employ them, or are they freelance associates?
I employ most of them, but other people who are in the building, for example, the dietitian and the counsellor, they are self-employed. The physiotherapist, it's Owen's business, PSI Clinic. He just rents the room, but we do all the support act for that business. So we would make appointments for him, we would take the money for him. He's included in all our social media. There's a link from our website to theirs. So this is how this umbrella business came about. Mourne Private Clinic.
I'd love to talk to you a little bit more about that. So when did that idea form, and what were your feelings around it at the start, and then how did it happen? Because it's just happened.
Well, it's actually super exciting. We were in a little business, a little beautiful little quaint building, little stone-faced building on Bridge Street, 2B Bridge Street. And the building beside us is absolutely beautiful, but it was a HMO, so there were multiple occupants. And I always had my eye on that building. I thought that would be fabulous for our patients. Beautiful waiting area, lovely environment, great front facing, very central. Although the little building we were in was more than adequate in the beginning, as Mourne Scan Clinic evolved, we needed more space. And I could see where we needed other really good professional services in the area, and I wanted them in my building. Because I had made all the mistakes. I knew all the things that, you could do to have a really good standard of a service. So I wanted to give everybody else this knowledge and include them in my work. And I just love working as part of a multidisciplinary team as well. So it's not just radiographers, and it's not just physiotherapists. There's lots of coming and going. But this beautiful building, I had said to my landlord at the time, who owns both buildings, if that ever becomes vacant, don't pass me. And it became vacant last year. And of course, it was a huge jump in every aspect, from rent to insurance to everything else. But I decided to take the leap. Wow. It's just the most beautiful environment to work in. It's a lovely space for patients. It's a very calm space, lovely big open waiting area. It's very relaxed. The clinical rooms are still clinical rooms. They're X-ray room and a DEXA room, but you don't have that. I think it's just more personal. You don't have that fear of going into this clinical space. We've got nice artwork on the wall, nice colours, and I think it all adds to a patient experience. And I think it's very much patient-centred building and patient-centred service.
So obviously you're getting that off the ground, but you've all of these people in situ now. People know you for the ultrasounds. Has it been, have they come?
They have come. Yeah, I think we built up really good relationships whenever we were just Mourne Scan Clinic. The GPs get to trust you. They know your work. They know you won't mess people around. They know if you're not sure about something that you know your limitations, and you're not afraid to say, listen, this is outside my area of expertise. You need to go to a consultant, paediatric radiologist, whatever it might be. That we don't say we know everything, but we'll absolutely put your hand on your heart and say, I did my best for that patient. Anybody that walks in through the door will get the best of you. And if you don't know, you'll either find out or you'll send them to who will know, who is the expert in the field. So I think when you come in, that you have that that security, that you know that, you know, there's no BS. You know, we're going to treat you very well.
And there is a little bit of fear around, you know, private offerings, that it's all just about the money, that you're fat cats and you're just, you know, benefiting because of the crisis in the NHS at the minute. And I'm sure that that has helped generate, you know, a market for you, but that's not what you're about.
It's not, it's not. It's certainly not about, well, it certainly didn't start out about the finances, and it's still not about the finances, but I just think life is kind of short, and enjoy what you do. And I think in a small town like Newry, you can't charge the big prices that you might whenever you're going to Belfast or whatever to consultants there. We can provide a really good service here in Newry at a much more accessible cost to people. And we really do try to keep the prices down. I suppose you don't really see the price of medical indemnity insurance and that type of thing, which is crazy. And people think, oh, £140, that's a ridiculous price. But actually, if you priced around, you would realise that actually that's a very, very good price for a scan or whatever it might be. So all in all, we want to put our day in doing a job that we enjoy and doing our very best for the patients. And for us, that's what it's about.
And for a lot of people too, health is their priority. Well-being is massive now. And to go to your GP and wait to be seen if you have a concern, especially if it's not a crisis situation, you know, you might wait years to find out if there's anything wrong. So are you finding that that's a lot of people are coming to you saying, look, I just don't want to wait. I just want to know. Yeah.
A lot of people even come in, just walk in the door and say, I need a scan. I need an x-ray. They haven't seen their GP. They really don't know where to turn. They're afraid because everybody talks about how difficult it is to get to see their GP. And maybe it is more difficult than it used to be, but the service is there. And they're doing their best as well. But we can provide a one-stop shop. So if you walked in and you said, I think I need a chest x-ray, we'd say, okay, do you have a referral from your GP? No, I don't have a referral. I haven't seen my GP in 10 years. That's okay. We can provide that service where we can get you to speak to a GP on the phone. So we collaborate with a private GP, Tullyvallen Clinic, who can speak to you on the phone, can decide yes or no that you need a chest x-ray, or if there's something that's more appropriate for you, and they can advise you on that. If you do need a chest x-ray, they'll do the referral. We can do the x-ray. You'll have your result in an hour.
In an hour. Mm-hmm. And explain to people, why do you need that GP referral?
Well, you don't need it for ultrasound because there's no radiation involved in ultrasound. So as radiographers, we can take your history and we can make the decision whether or not ultrasound is appropriate for your symptoms. And we can go ahead and do that scan if we think that's appropriate. So we've guidelines for that. But for DEXA scans and for X-ray, there's ionising radiation involved. So there's very, very tight regulations involved around that. So again, we've guidelines as to what we can and can't accept, but even if you do have a referral from a GP, we may still not be able to accept that. For example, if it's a patient who has back pain, it's such a huge dose of radiation to X-ray your back that you have to give us more than that. You know, it wouldn't be appropriate just to do an X-ray if you've got back pain.
Oh, interesting. So what, you'd be better to get an MRI or something like that?
An MRI has no radiation involved.
But you don't offer that?
We don't offer MRI scans in Mourne Private Clinic. No, we won't be offering MRI. But it's just, there's criteria that you have to meet. You can't just walk off the street and say, I want this, this and this. You know, you need to have a little bit of medical knowledge and you need to have fulfill the criteria in order to get what's actually appropriate for you. So we need to get medical advice for that.
And explain what the DEXA scanning and X-ray service is.
So DEXA scanning is something that's really interesting, and it's actually very new to me as a radiographer. I've never specialised in that field, but I've really, really enjoyed learning about it because it's quite intricate. It's about bone density and whether you're menopausal, whether you've had fractures that you don't know about, or that you've no trauma and you've had these fractures in your back or your wrist or whatever, that you've no trauma and these fractures have occurred, you realise that maybe my bone density is not good. So a DEXA scan basically measures your bone density. So we've two areas of your body that we scan: your lower back, which is at risk of osteoporotic fractures, and your hip. So we can basically determine what your fracture risk is according to how dense your bones are. So if your bones have a good density, your fracture risk is low. If your bones are thin, your fracture risk is high. So people who don't know they have osteoporosis or osteopenia can go onto medication to improve the density of the bones if they know in time.
So a lot of people are now going to you perhaps to get the scan or get the information or the diagnosis. Mm-hmm. How does that feed in then if they're going back maybe to the NHS to go further, or do they stay in the private system after that?
Well, they can stay in the private system, but we don't provide treatment. We cannot advise on treatment. It's diagnostic services. So we provide them with the information to go back to their GP. It might be something, well, we say that, but everybody who comes in for a pregnancy scan is obviously already in the NHS and they're getting their private or getting their NHS care through the hospital. But anyone else who's coming in, maybe abdominal pain, they might have gallstones, they must go back to their GP because they need a referral to see surgeons in the hospital if they've gallstones. So we tell them what we see. We write a report and we say, look, we'll send the report to your GP with your permission. And then you need to contact your GP to discuss it with them, what the next steps are.
And you've said that you've great relationships with the GPs, because I was wondering, is there a bit of a disconnect between private and NHS? Do you find that always the scans are received and viewed with the same respect?
Well, I suppose I don't really see that side of it, we would have GPs contacting us. They refer patients to us because I think from their point of view, if a patient comes in and says, how long do I have to wait on a scan? Where can I get it? Then the GPs do refer to us as well, which obviously they must take your service seriously and they must have some sort of regard for the results that we provide them with. And that's the sort of feedback that we get, rather than when the patient goes back to the GP. We don't really hear about them after that unless maybe a year later they come back for a follow-up scan. So that's how we find out whether or not the GPs have any regard for you, is when they refer their patients. So that's a good enough recommendation for me.
And I'm not going to dwell on the crisis in the NHS, and I'm not going to make you
yes.
somebody to blame for, but I think there's a lot of people listening and, realising that something needs to change, and maybe private is part of the solution. Do you feel that private takes the pressure off the NHS and waiting lists in a way?
Well, the way I look at it, Sarah, is that it gives people options. If you are in a position to have private care, then that takes that person off the scan list, off the X-ray list, off the DEXA scan list. So someone else will move up the chain or move up the list. I don't know how the NHS is going to be resolved. I love the system. I think it's amazing that we can all get our care. Everyone that I know uses the NHS. Not everyone I know accesses private health care. So I have utmost respect for the NHS and for the staff who work in it. I was trained by the NHS, so, I've good colleagues that work there still. But yeah, who knows what the solution is. But I think there are more and more private services, and I think it is a very good way forward for a lot of people. And I think by making it accessible and not too expensive, that people can dip in and out of private care a little bit, and it helps them along their way to diagnosis and to treatment and to recovery.
To be in a job where you have a good work-life balance as well, is that very different to when you were working for the NHS?
I think I have a really good work-life balance now. I think my family are very understanding of where I'm at. I talk about work all the time at home. Not about patients, obviously, about work. But, I get up early in the morning, I walk my dogs, I take a lunch break. I don't work till 5 most days. Sometimes I do an evening shift, but we're open 7 days a week. And 1 or 2 late nights in the week. And I've been able to recruit people who work on the NHS and the HSE to help me out. I'm not afraid to say, listen, I really can't do any more this week, or I can adjust my work schedule. So if I need my hair done, I'll block off 2 hours in the middle of the day. You know, I think I've got the balance now. I'm not really looking for anything else. I'm not looking for less hours at the moment. I'm enjoying it.
Yeah.
And that's giving me that, you know, va-va-voom, you know, to get up in the morning and get into work.
And you haven't moved from being that person who delivers and practices to, you know, working on the business rather than in the business. Do you ever see that as a possibility?
I definitely do both now. I used to scan Monday to Friday, 9 to 5, but now I'm doing sort of half days here, half days there. There are some things that only I scan, so we try to get those things onto my lists, and then the stuff that the other girls do. While they're scanning, I would be in work doing the other things like organising, you know, things like this, or advertising, or whatever it might be that has to be done as well. Paying bills, all of those things are done when someone else is scanning. So I think it works okay. It works well, in fact, because I'm really, really lucky to have very, very good sonographers, which it took a long time to get the balance right and to get the right people. But everybody that's part of the team now is a really good team member, and they bring so much to the table, and everybody brings something a little bit different. But everybody gets along, which is really important to me. Everybody's valued. Everybody is the same. We all wear the same uniform, whether you work in reception or whether you're a clinical staff. Apart from Jeff, who's the only male radiographer, and he doesn't want to wear a tunic.
He doesn't want to wear a tunic. Jeff, what's wrong with you?
No, that's absolutely fine.
Well, yeah, and as you've grown a business, you know, with that comes responsibility for the people who you employ, to look after them, for them to feel valued, as you say, but also to make sure that they're the right person to carry on the values that you have. And, you know, you've obviously built a business where the patients have been so important to you, and that customer care is so crucial. When it comes to the culture of what you're building now, and I know that we're kind of evolving as we speak, what would you say your fundamentals are, your core values are for your business? What do you want people to look at Mourne Private Clinic and say, I know what I get there, I know what that's about?
Yeah, I think we're very, very honest and very straight with our patients. All of the staff are very, very experienced. We don't have anybody who doesn't have really good experience in their job. And I suppose, you know, we would say to the patients, listen, we're not doctors, we're radiographers. This is the information we can give you. We don't try to make it flowery in any way, but it's only a very small piece of a jigsaw that is your health. We can give you this amount of information, but you need to collaborate with your GP and whoever else that you need to move forward with. Very often we just get phone calls for us to signpost them to the right person. It might be nothing to do with the scan, but people will phone you up and they say, I just don't know where to turn. But the girls in reception are so used to that they pretty much can rhyme off, you know, the numbers of every other private facility in Northern Ireland, because, you know, we want to do the best for people, whether they're a patient of ours or not. You know, you can say to people, listen, we don't do MRI, but there are several places and they'll look after you. Make sure you have your GP referral. You know, so we're so well used to these phone calls now that we have this portfolio of referral numbers and things that we can just list off to people. So it's not just about our patients. You know, if somebody comes to you looking for information, we are more than happy to share it, you know.
How important are honing those good communication skills in what you do? I mean, I'd love to think that people come in and they're reassured by the scans that they receive, but very often it involves breaking bad news.
Yeah. Well, that's never easy. It's part of our job almost every day, if not every day. And I think that's something that's very valuable that the other staff bring that work in other places. You know, Deirdre's a midwife. She works in Our Lady of Lourdes Hospital in Drogheda. So she's very used to midwifery care, so she's coming from it at a slightly different angle than I am. Sandra's also works for the HSE. She's a radiographer there. They do things a little bit differently than they do in the NHS. I have 2 girls that work for the NHS in the Royal, and they're also very well trained in different aspects of ultrasound, so they bring something new to the table. But I think, in a way, to lead by example when that comes because I still every day find it difficult to say to somebody, I am so sorry, but there is no heartbeat. Some people take it reasonably well because they're expecting it. Other people, it's complete and total shock, and that's really tough. But most women, I think, have had a miscarriage at some stage, or some sort of a bad news, whether it's a scan or whether it's a result maybe of IVF or something like that. So I think over the course of experience, there's really nothing like experience for you to gauge a person's reaction and know how to work with them. Even how you word an email to them, because we have to provide them with a report. To lead by example, to say to the girls, this is a template, but you must say, I'm so sorry to give you this bad news in an email. This is your report. This is the information we need to give to you. This is the number that you need to phone to speak to the midwives, to get an appointment to go in and see them. So once the template is set up and they see you doing that, that is the standard. You don't go in and say, listen, it's not worked out for you.
You can't just leave it at that.
We don't do that,
No.
So they wouldn't do it anyway.
No.
But I think when they see how I behave, that sort of sets the standard, I think.
And how you'd want to be treated yourself.
Absolutely.
People are vulnerable when they come to you, aren't they?
Oh, of course, yeah. No matter what
Not
it is.
just if your pregnancy, but in any of the...
if it's a sore shoulder,
exactly.
if it's, anything that, people are vulnerable, they're in pain or they're worried. They don't come and pay for a private scan for the crack of it. They come because they are concerned.
And would you find too, because of the waits in the NHS, that, people are maybe presenting and they're sicker than what they should be? They've waited too long?
Generally not.
Good.
No, generally not. I think it doesn't often get to that stage. We did find, in and around the COVID times, people didn't want to go to the hospital. We stayed open during COVID. We just changed everything around. We left really long appointment times and things like that so we could accommodate people. We wouldn't have two patients in the building at the same time. It was one at a time in and out, things like that. But during those times, we found that maybe people left it a little bit longer, or the people were really health anxious. They were worried about little things that really otherwise you might wait. But they didn't want to wait. They wanted to be sure that everything was okay right here and now because they were so anxious about their health. Everybody was worried about their health at that time.
We often hear that men aren't great at talking and going to the doctors or going to get help. Do you find that? Would you get more women coming, obviously, for the pregnancies, but... are men coming to you now and wanting to know?
Well, every day we get women who are ringing up, making appointments for their partners or husbands or brothers or dads for every single day. And they come in.
They're the worried ones.
And you would say, well, how can I help you? What are you here for? And they'd say, oh, the wife sent me in. I was told to come in because I have a lump on my back and whatever. So it is true. Men really aren't maybe as proactive about their health as women are. Well, it's a generalisation, but I think women are certainly on it, and they're on it for their whole family. They're looking out for everybody, so they're making appointments for everybody in the family to make sure that everybody is well cared for.
That's what they do, isn't it? And maybe
that's what we do.
Not looking after themselves in the process. So you've really widened the offering now. So you've scans and testing for all kinds of different things. Where do you see yourself going next? Will you expand the offering further, or are you happy with where we're at now?
I think we have to be really particular and be good at what we do now. So we're working hard to get everything absolutely spot on what we do now. And I'm very particular about who comes in. So we call it trusted partners. So we rent out rooms to allied health professionals. So, for example, the dietitian, the counsellor. And what we really want to do is to make sure, they represent Mourne Private Clinic when they come in as a service, although they're independent businesses in their own right. So yes, I would like to expand the business, and that I would like more allied health professionals to come in and use the rooms, maybe speech therapy, podiatry, maybe other types of businesses. But for now, I'm really happy with what we have, and we want to get the word out there that we are here, and the standard of service that we provide is really good. So once we've that honed, then we can maybe move forward and look for other new services.
And I suppose we should talk cost. I know you've mentioned that the cost of an ultrasound, but Do you have any schemes in place? Do you allow people to come and use their private medical insurance to cover these diagnostic tests? Is that what you're seeing? Or, how do people pay?
Well, yes, private medical insurance is definitely become more and more common, which is fantastic. Not every private medical insurance will cover the cost of our diagnostic services. So we always say to people, look, just check with your insurance provider before you come to us whether, we need a number or whatever it might be. But we also offer collaboration, discount on collaborations that we have. So Louise, the practice manager, is great at collaborating with local businesses. She's a local girl. We like to keep things very local in Newry. So lots of local businesses, we'll give them discount. If their clients, customers come to us, if they get a recommendation, and we give them a little bit of discount, they give us a little bit of discount. If our patients, we say to them, yeah, that's a great baby shop. If you ask them, tell them you were here, they'll give you discounts. So we actually have a little list of collaborations that we do. And that helps. Everybody loves a bit of a bargain, don't we? And 10% is a lot whenever it's a lot of money, like a scan or an X-ray or whatever it might be. So we're happy to do that because we're helping each other out, and that's a strategy that I suppose Louise has really worked hard at getting, and it gets people to trust you as well, other businesses. So that's another thing that we've done, and one thing that we've done quite well too is that within the business of Mourne Private Clinic, we have been able to provide patients with a collaboration of the physiotherapist and the ultrasound scanner. So if, for example, I'm in scanning somebody's shoulder and I think, God, you would really benefit from some physio advice on this. How would you feel about getting the physio in? So sometimes Owen just comes down the stairs, has a look and said, yeah, I agree with that. I can see that on the scan. Let's do a treatment plan out for you. He'll do some examinations of his own. So the patient comes in, gets their scan and their treatment plan in a little package deal, which you won't get anywhere else.
No, you would wait a long time for that to happen.
Yeah. So it does save a lot of time. It streamlines things for us.
Lisa, what would you say the biggest challenge has been to date?
Oh, we've had lots.
That you want to talk about and reveal. It's all been plain sailing business.
Well, I suppose from the very outset, learning about business, because when you're brought up in the NHS, you don't know a thing about business. As say, your money just arrives at the end of the month. But learning about social media, advertising, marketing, Catherine McGinn, MacPR, has been fantastic at supporting us that way. Do you know what it is? It's not being afraid to ask people for help, Mm-hmm. So you find that you've come to a stumbling block, talk to people about it and say, where do I go from here? What has to happen? Whether it was moving to a new building where we needed a lift, things like that, just challenges. You just ask for help and ask around. And 9 times out of 10, people are more than willing to help you out. So all of those little challenges have been overcome. And now we're sort of sitting happy where we want to be with lots of friends and collaborators, and it's working really well.
And I'm sure whenever you qualified and you got that first job all those years ago, you perhaps never thought you'd be sitting with this wonderful business that you have now.
Oh, jeepers, no.
You must be so proud.
Well, I suppose you never really stop and think about it, do you? People say that to me, you should be so proud of your achievements, And when I stop and think about it, yes, I am proud. Even 10 years ago, I'm 25 years qualified, 26 or 7 years qualified. Never in my wildest dreams would I have thought this, because I loved what I did then, but each step of the way I've loved it, but I've just wanted to evolve it a little bit more, bring it a bit more, my personality to it. So yes, I am proud, but there's always more to be done.
The purpose of this podcast, Lisa, is to inspire existing business owners and ambitious entrepreneurs to grow their business by offering an insight into the success of businesses such as your wonderful Mourne Private Clinic. So the last question I ask everyone: what advice would you give to people who may have a business idea but have no idea where to begin, or are unsure as to whether that risk is worth taking?
Well, when I think about it, you really should have a plan. I can't honestly say that I really had a plan in the beginning. I was lucky to a degree, but I had a skill. I had a skill that I could develop into a business, and I saw a little niche in the market. And I suppose when I look at it, the plan was to dip my toe in the water and to try and test it and see if there was a market. I suppose that was my plan. That was my business plan all in one. I think it's a good idea, as I said before, to know your limitations and know that you're not going to be good at everything whenever you first go into business, but not to be afraid to reach out and ask for help and ask for advice and talk to people, network, which is really not my thing, but I realise how beneficial that is, just to be able to help each other out, in business, and not be afraid to talk to people about it and talk about the difficulties as well as how wonderful it all is. People are really good at telling you how wonderful everything is, but actually it's not always wonderful. Sometimes you need to say, that's not really working out for me. How can I change that? How can I move forward? And that's when collaborating maybe with another business or getting advice from business executives, whatever it might be, even friends who are in business or family or colleagues, just getting some advice. So don't be afraid to take a risk. And I think I just have a can-do attitude, whether it's an IKEA desk or an X-ray department, I just try to make it work that way. So anybody who has a can-do attitude can make a business work.
Absolutely. I love that. And I'm so delighted for you. And good luck with the Mourne Private Clinic. I'm sure there's lots more to come. Lisa Hughes, thank you so much for joining me on the Public Eye podcast today. And thanks everybody for tuning in. Do join me again next time for another episode of the Public Eye podcast. This podcast was recorded in Granite Podcast Studio. Interested in starting up your own podcast but don't know how? Granite Podcast Studio can help. Record your podcast in our state-of-the-art studio, which is based in the heart of Newry City. Our studio has cutting-edge and user-friendly technology and can seat up to 4 people. We also provide an editing service for our team, using your guidance and editing notes to provide you with a flawless finished product, leaving your listeners wanting more. For more information on how you can get started, visit www.granitepodcaststudio.com.